It's Friday in medical device. I'm 130 miles from home. It's going to take me about 2.5 hours to head back that way. It's about 1 o'clock. Want to prove to you that I'm that far out. There were 0 bugs on this windshield when I left. Road warrior. I took off my pajama top to show my more edgier Bandito shirt and just stocked up on Coke. This is going to carry me through next week. The hardcore device guys, big Diet Coke drinkers. People are always amazed and want to know, you're actually in surgery? Yes, we are. You know, the reps, we're the expert on the products. The doctors are the experts on performing the surgery. But if you think about just like anything else, like maybe you're an expert pilot, you probably don't know every single bell and whistle on every single plane that's out there. So it always helps to have a guy like me in the room to help guide you in these procedures. Now, it is a big difference between what I used to do or what I have done in other sales jobs. Like I sold pills, pharmaceutical device, pharmaceutical rep, great job. With med device, my job tends to get more complicated the more product I sell because of the case support aspect of that. So we help with the setup, trays. There's these sterile trays. So we'll help the staff in getting those ready. Also in patient prep, you know, you have to basically clean the patient and get them ready for surgery. There's differences in that. And then when you're in the actual procedure itself, everyone's anatomy is so different that oftentimes I can help, at least for what I do, to come up with the best plan of attack in these surgeries based on the expectations or the merits of what our product can do. So, you know, if you think about that, I mean, it's, you know, there's a lot of pressure. The stakes can be extremely high, and they are high. I mean, the stakes are patient outcomes, not just, you know, does the doc like the medical device? So these are things for you guys to like think about. You know, sometimes the patients are asleep, sometimes they're not. You have to know basically like, you know, how to act within that, the realm of that surgical procedure. And it's oftentimes you need to ask the physician how they like feedback, how they want you to guide them. They of course want to be seen as the authority and the expert by the patient. So you need to take that into consideration and have that conversation with the surgeon before these procedures even kick off. Of course, depending on if the patient is awake or sedated. The other thing that you need to keep in mind is if the patient is awake, you know, you have to look like you're part of the team, be a part of the team, not look like something that's out of place or would seem different to the patient. And you need to, you know, be smart about the way you engage with that patient in a very professional way. At the end of the day, the reason why we're all in this business and we do what we do is because we do care about these patients and we want them to have the optimal outcomes. Now, that's one of the reasons why I like the device that I sell so much, is that it truly is the best in anywhere. It's the best in the product category. If your mom or your aunt or your grandma or you were having this procedure, I 100,000% confidently can say that I would want these physicians to use it on me or my mom or my grandma. So that's another kind of side branch or side point or thing to consider. Like if you want to take the leap into medical device, go into something, get something that you can stand behind, you can get behind, and you can truly believe in. Otherwise, it's going to be, you're not going to be genuine, right? So there's so much value that we bring into these cases, and there is a bit of learning and I guess wisdom and experience that comes into the job, which is why for me, the pinnacle of sales is med device, because you have to take the sales process and everything that's involved and then add this hugely technical component onto it. And don't forget, the stakes can be as high as the highest level, patient outcomes, right? So anyway, things to think about. Hope this helped. I'm about to get started back home and get my weekend kicked off. Good selling.